let's go back to this. And then share screen one, and then let me pull up screen one. Okay, so let's take this from the top. So we've already covered the part about we'll meet every Tuesday night. We'll meet at 6 o'clock. We will, again, the aim of the course is to the aim of each class is to provide just a basic overview of what we need to cover for the week. For last week, again, last week being a short week, the only thing that was there was the Peregrine exam. I will say I had a couple of questions about the Peregrine exam. Let me be sure you understand what this is about. When you, particularly for those that are pursuing a degree in healthcare management, we have to show some level of comparative testing between us and other programs that offer healthcare management. And so in doing that, the Peregrine exam is actually the exam that's accepted by AUPHA, and that's the Association for Undergraduate Programs in Healthcare Administration. So they require some type of what's called an entry-level test. Peregrine is probably the cheaper of the entry-level tests that are out there that we can use. But it basically means this: we have to be able to show that we've evaluated any person who takes a part of the healthcare management program, and HCM2000 is a good entry-level course. And so that's how we use that. I will say this, there's nothing specific to study for. It's basically like taking the SAT. It's based on measuring what you know. And it's okay, you're taking an entry-level class. It's okay to not know a lot if you know anything at all about healthcare. So if you, the only thing I would encourage you not to do is don't just kind of click through for the sake of check the box. Do your best, but again, it's binary. If you complete it, and when you complete it, submit the certificate that you completed it, and then you get credit for having completed the test, okay? But it is binary. You either completed it or you didn't, so I would certainly encourage everyone to complete it. And I think I've got it listed. That is open. Let me check on that assignment. That assignment closes on Sunday the 13th. So you have basically 3 weeks to get that done. I will say this, most of the assignments, and I'm not sure how your other instructors use Moodle. I've used, if you were at UNO before this semester, you'll notice this is a different layout of Moodle. I've used Moodle at several universities now, and so this format is a little bit different than what you may have seen in the past, but they're all relatively intuitive. So as you move around on them, it's pretty easy to find your way through it. I do like what's called the tile appearance, and I realize you can't see some of the weeks in advance, but the first 4 weeks that I've activated include the overview of Peregrine that was last week, terms and abbreviations. The main thing I would tell you about terms and abbreviations, in healthcare we have somewhat of our own language. Sometimes we talk in acronyms. It will be important for you to at least try and understand what you're seeing, because you'll see a lot of those terms later on. And
I have a question about the list of terms.
yes.
So for gathering there's terms.
I'm sorry, I only heard just a couple of your words. If nothing else, okay.
I was just curious if there is a particular website you'd prefer us to use when gathering the terms from the term sheet.
So Let me pull it up just a minute to see if I understand a little bit more of what you're saying. I mean, the main thing I would do is understand a little bit more of what the words mean. And as far as a particular, just understand that you'll see most of these words as we move through the semester. Okay. Uh, the abbreviations or the acronyms, I did want to be sure and include those because, again, you'll see, um, particularly when we talk about Medicare Part A or Part B or Part C or Part D, and when we talk about the history of healthcare, how that unfolds. And speaking of which, I need to be sure and hit a couple of those things tonight. But is that helpful?
Yes, sir, that works.
Okay. So let's see, let's go back to our tile for tonight. And so the history overview, this is actually, I wrote a book a couple of years ago about hospitals primarily in Eastern North Carolina, but I say that if you omit the fact that it says Eastern North Carolina, the history of healthcare is basically the history of healthcare. I did talk about insane asylums and feeble-mindedness institutes. Just understand that this is a North Carolina example. It applies in Louisiana and most of the American South. I will say that there are words that we've used in the past that we still use for historical reference, but those words can certainly are hurtful. And again, we just need to be mindful of the fact that I do use them because that's how you will see it in context. But I would also encourage you to think about how we discuss those things today. We certainly don't talk about someone being in the madhouse today as an example. But I will say, if you think back to the late 19th century, we referred to people who were in a mental hospital as being someone who was in the madhouse or was in the insane asylum. A madhouse is more likely to be a European term, but you will see some reference of a madhouse in the United States. You'll also see a pest house. You'll also see almshouse. So let me, as an example, an almshouse is for what we later referred to as the old folks home, a rest and retirement type center. Typically a skilled nursing type facility today, but that's what an almshouse was. And then a pest house, we didn't understand communicable disease very well 150, 200 years ago, but we felt like, we as in mankind felt like most diseases were spread by pests. And if we took all of the sick people and put them in a building with the sick pest, they would stay away from the well people. We didn't realize we were quarantining people at the time or isolating people at the time, which really is one of the solutions in public health. But that's how the term pest house came about. It's mostly associated with the 16th and 14th century plague, but certainly was quite prominent. And you'll find lots of examples in the United States. You'll find examples of a pest house in New Orleans in the late 18th or early 19th century. And then the difference between hospital, the first U.S. hospital system, we actually had a national health system. It was the U.S. Marine Hospital System. It was constructed at mostly ports, and it was primarily for people who, if you, again, 150 years ago, if you looked at the American healthcare system, if people were sick, they stayed at home and the country doctor came to their home and took care of them. If they were traveling, they may need a hospital. If they lived in a large city, they may need a hospital. New Orleans was one of those places. New Orleans is a real outlier compared to most cities for healthcare. Most cities did not have hospitals before the early 20th century. If they did, it may have been a U.S. Marine hospital as an example. Now, New Orleans had a U.S. Marine hospital. It opened in the early 19th century. Much of the building still exists today. It's down next to Children's Hospital. That was the old Marine hospital. And then the Marine hospital system actually was created in 1798. And again, it was a national health system that existed primarily for mariners. They collected a tax for it. Quarantine camps or temporary hospitals are common. They're particularly common in New Orleans because, you know, we had thousands of people that died from communicable disease each year. We had particular hospitals in New Orleans just for smallpox or just for yellow fever. I mean, that's why more than half of the city today is below sea level to help mitigate against all of the diseases being spread by mosquitoes. 150 years ago, they drained the swamp. But again, if you suck water out of a sponge, what happens to the sponge? It contracts. And for New Orleans, what that means is most of the area, Gentilly, New Orleans East, all of that was swampland. And as it contracted, it settled well below sea level. But anyway, it did save us from the mosquitoes and the diseases they were creating. Let me hit just some of the basics of, let me go over the terms in the presentation. One of the things that I try to remind people, first of all, can you see, can you see this? Let me move this over here. Can you see this graph, why healthcare? Okay, so the main thing this shows you that I think is fairly fascinating is the fact that the largest employer as of December of 2018, the largest employer in the American economy today is healthcare. Now, if you're taking economics or finance, that'll leave you kind of scratching your head, but just understand we spend more money on healthcare than any other country in the world. We spend more in per capita, and we spend more in gross dollars spent. It's a substantial amount of our economy, and in fact, in more than a third of the states in the U.S., the largest employer in that state is healthcare. So again, that's a little scary when you think about the role manufacturing plays, or at least has played in the American economy. But again, it does give you an idea of just how dramatically things have changed in America. Let's see, there's the other thing that I want to be sure and show you. Let's look at let's look at session 2 as well. Session 2 has some of the keywords that we need to be sure that we know. Again, hospital as we know it today is, it does evolve from Greek and Roman history, but primarily hospitals, if you looked at most hospitals, there was a peak where there were a significant number of hospitals that existed in the United States between 1800 and 1899, and that was actually during the American Civil War. Other than building hospitals for the purpose of taking care of soldiers, we didn't build a lot of hospitals in the United States. The other exception to that was we built a lot of hospitals near ports, and they were marine hospitals. Later on in the late 19th and early 20th century, we started building a lot of hospitals along the railroad lines, and we'll talk about that later. That actually became really the first managed care system was railroad medicine, where railroad companies own large hospitals. And actually there was one of those in New Orleans as well, but we'll talk about that later on. Pest house, madhouse, and almshouse. Again, pest house also may be referred to as a French term of lazaretto, but it was a place to isolate or quarantine, isolate people who were sick, quarantine people who weren't sick, but it was to move people away from everyone else who was considered healthy. Madhouse, a madhouse, again, referring to a mental institution. We also use the word asylum. Just remember, the word asylum means a safe place. And so an asylum has not always meant a safe place to everyone. But sometimes we have used the word asylum when we talk about mental health and mental institutionalization. The almshouse, again, for older people. If you don't mind, I am going to go over a few minutes simply because I've drug on the first 10 minutes of the class talking about something completely unrelated to you, if that's helpful. If any of you need to go, you certainly don't have to stay, but I do want to be sure and cover these terms at least. A sanatorium, you may see that spelled a lot of different ways. Sana comes from the Latin meaning health, and then it could be spelled with two A's, it could be spelled with an A and an O in place of the O. But the whole point is, it was considered a kind of a health place to regain your health. And up until 1900, 12% of the world's population died of one disease. Do you know what that one disease was? Tuberculosis. Now you may see, if you're reading historical text, you may see it referred to as consumption or Pott's disease, but it's a bacterial infection known as tuberculosis. And so, in fact, by the mid-20th century, the largest hospitals in America, particularly the largest state hospitals, were 4,000 and 5,000 bed sanatoriums for people recovering from or dealing with tuberculosis. They may go to a TB hospital and stay there for 5 years, 6 years of their life. But they were referred to as state sanatoriums. There were also a lot of small sanatoriums. They were typically owned by one or two physicians who lived in a part of the building, and then they served as also small private hospitals. The Flexner Report occurred in 1909, 1910. The Flexner Report was intended to improve the quality of medical education in medical schools. The reality was it particularly hammered medical schools that catered to minority populations. In fact, by 1920, as a result of the Flexner Report, only 2 medical schools still existed in America that primarily catered to minority populations, and I'm talking specifically about people of color. One was in Louisville, and the other one was Howard University in DC. Again, the Flexner Report, through the eyes of some, was well intended. Through the eyes of others, had a more draconian approach. Regardless, it closed a significant number of medical schools and left a lot of underserved communities, and particularly rural communities, without sufficiently trained physicians into the 1930s, 1940s as a result of the Flexner Report. A general hospital is just that. It provides a lot of different services. The Marine Hospital System, I've got several slides about it later on, created in 1798, existed at most of the ports, primarily targeted mariners, people who were away from home. Blue Cross and Blue Shield originally started Blue Cross as a hospital insurance, Blue Shield as a doctor's office insurance. I've got several slides later in the presentation that tell you a little bit more about it, but just understand Blue Cross and Blue Shield were used to model how Medicare Part A was created, which is similar to Blue Cross, and Medicare Part B was created similar to Blue Shield. Medicare was created in 1965. Medicare is primarily for people who are 65 and older, and then there's two other groups of patients that can get on Medicare. Those are people who are disabled and people with who need kidney dialysis. It's called ESRD, end-stage renal disease. But Medicare is primarily for the elderly, and you'll see that question a lot in future quizzes. I would be sure I know that. Medicaid is primarily for people who are financially disadvantaged, and that can be for young people. It can be for the elderly. The only qualification to receive Medicaid is based on your financial position in life. The Hill-Burton bill, or the Hill-Burton Act, built a lot of hospitals. It was passed in 1946. You'll see a lot about it. There were literally thousands of hospitals built in the United States as a result of the Hill-Burton Act. It did help make up for some of the damage caused to rural communities by the Flexner Report. And again, we'll get into that a little later. Title 18, 19, and 21 is really the way Congress works. Congress could not, so in their wisdom, and sometimes Congress doesn't always do smart things, but in their wisdom, in this particular case, they did something really smart, and that was, rather than creating a completely new law for Medicare, because it was controversial at the time, and a new law for Medicaid, they decided to amend something that was very popular and still is very popular, and that's the Social Security Act. And so they added Title 18 of the Social Security Act, which is Medicare. And Title 19 is Medicaid. And Title 21 is actually something called CHIP or S-CHIP. It's a children's version of Medicaid that expands what's available to children that's not available to their parents. BBA 97 is the Balanced Budget Act of 1997. On one hand, it cut a lot of money out of healthcare. On the other hand, it redirected money to certain parts of healthcare that we hadn't had before. Again, CHIP or S-CHIP, that's the Children's Health Insurance Program. Again, you'll see a lot about this later on in the presentation. And CAH, which is the Critical Access Hospital, and Medicare Part C, which is the a managed care version of Medicare. And then in 2004, the Medicare Modernization Act was passed, which is Medicare Part D, which primarily deals with prescription drug benefit. The Stark Law, you'll see something about it later on. It deals with competition issues. It basically means if I'm a doctor, I own the drugstore across the street, I can't send you to the drugstore across the street without telling you I have a financial interest in the drugstore across the street. Before Stark Law, self-referrals were common, even if they were widely unethical. COBRA and EMTALA, it started out as COBRA, later became EMTALA. You'll see EMTALA again later on in your presentation. It's the Emergency Medical Treatment and Active Labor Act. It basically means if you have an emergency and you present with an emergency to a hospital that is certified to provide Medicare in the emergency room, they cannot question your ability to pay before they provide medical care. Same thing goes for a woman in active labor. If you present, again, to a hospital, it's a certified hospital, and most of them are, and you're in active labor, they cannot turn you away based on your ability to pay. They have to provide emergency care until your condition has stabilized. DRG is a diagnostic related group. It began to be phased in 1981. It dramatically changed the way we pay for healthcare, and you'll see a lot about that in your presentation. It is important to understand the difference between the executive branch of government, the legislative branch of government, and the judicial branch of government. And the reason is you'll see things that the president does through executive order. Just understand there are limitations to those things. The president, we don't have a king. Sometimes our presidents don't always color in the lines, but generally speaking, they can't just say, I decree this is what we're going to do. They're the president, but they're only responsible for the executive branch. People who write the laws are in Congress. It's written in the House, conferred with the Senate. If the two agree, then it's passed on to the president for his signature, and if he rejects it, then it's vetoed and sent back. But just to understand the difference between an executive action by the president and a legislative action by Congress. And then finally is the judicial branch, and that's the Supreme Court. And a lot of things today wind up in the Supreme Court, particularly as it relates to healthcare. So it is important to understand the interplay between what Congress does, and I'm talking about the House and Senate, what the White House does, which is the executive branch, and then what the U.S. Supreme Court does and their determination. And then the last 5 things here: HIPAA, HITECH, PAPA, MACRA, and P4P. HIPAA is the Health Insurance Portability and Accountability Act. Primarily deals with privacy of information. It came about in 1996. It's been amended a couple of times, but it basically means you have a right to protect your personal health information, and you have a right to decide who that can be shared with. HITECH came about in 2009. HITECH was a way that, again, if you think about 2009, President Obama just took office. The economy was in shambles. They passed a lot of quick acting legislation with the intent to invest in the economy, to help spur the economy. HITECH was a part of that, and it basically created substantial investment in what we see with these electronic health records, which I mentioned earlier in a class that you're not attending. But anyway, you will see more about EHRs in this, and HITECH is a part of that. PAPA is the Personal Protection and Affordable Care Act, and the Affordable Care Act is sometimes referred to as Obamacare. The place that I have a little bit of heartburn in referring to it is that it seems to divide people based on whether they like or didn't like President Obama. The reality is PAPA is the law, and I actually think it's compared to what we had, it's a good law. It could be improved, it should be improved, but it's a law. It's you know, we don't call Medicare Johnson Care, and I'd rather we not call PAPA Obamacare, because again, people seem to like or not like it because they like or don't like the president. I think that's regardless. The fact is, it's the law, and because it's the law, it's an important law, and we need to understand it, and we need to evaluate it as that. Again, I think it's a good law compared to what we've had. I think there's places we can improve on it if we'll quit trying to tear it apart. But again, that gets really into a political narrative, and this is not political science. We don't want to get into that. And then MACRA is a reappropriation, refinancing the CHIP program. Another part of MACRA was to reissue Medicare cards that don't include your Social Security number. And then P4P is pay for performance. There's 3 components of pay for performance. We'll hit that later on in the class. But it is important to know that that hospitals get a large sum of money if they are not providing good quality service, if they're not getting good evaluation scores on their surveys. As soon as you go home from the hospital, you get a survey in the mail, right? They need to get good scores on those surveys. If they don't, they're dinged, and the pay for performance standards. There's a readmission component. If you were readmitted and you had one of the chronic conditions associated with pay for performance, such as congestive heart failure, if you're readmitted within 30 days for that same condition, the hospital won't get paid a second time for you to be seen for the same condition. And then the last one is hospital acquired conditions. That's a part of pay for performance. And again, we'll talk about this later in details. Let me come back to this. So by now you've had a chance to look at this and download this last week, hopefully. Were there any words on here that really that you struggled with, or you don't understand, or you want me to talk about? Again, each of these words you will see, or each of these abbreviations or terms you will see at one point or another during the semester. I do feel like it's important for you to understand how these words interface with the things that we're going to need to know. And if you don't have a question tonight, that's okay. Again, you can send me an email. I'll be glad to answer it. We can meet on Zoom. I'll be glad to talk to you, or we'll also cover it in future classes. But I do want to be sure I give you an opportunity to ask a question if you have one. And I don't want to leave you in awkward silence. Is there anything that you needed to hear from me tonight that you haven't heard? I'm going to go back and look specifically at the layout of the course one more time. I noticed something as I was moving through this. I need to be sure the presentations are in the right order. I will tell you so this is.
I have a quick question.
Yes, ma'am.
Which happens to deal with the list that you was just asking us, if we had any questions on. Do we have to know the definition to all of these, or we're just basically knowing what the abbreviation is and what that abbreviation stands for? I know that it would probably make more sense to at least have an understanding of what it is in general, but is that what's going to be on the test, or what we should know, I should say?
So what I would tell you is, let's see, whenever you pull up a presentation and you see a page of terms or abbreviations like this,
Mm-hmm.
I would know those.
Okay.
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 And by the end of the semester, all of those will equal all of these.
Okay.
Is that helpful?
Yes.
Yeah.
Yes, it is.
So what I'm doing by giving you all of these, I'm trying to give you kind of an advanced view of what you're going to see down the road.
Oh, okay. Okay.
Yeah,
All right.
I assure you, you will not see all of these in the quiz this week or next week. Yeah, that's not. It's not fair to you. It's certainly not fair to anybody else. So, yeah, but you will see this somewhere along the way. And I will tell you, you need to if you don't know, by the time you finish, you'll know the difference between Medicare Part A, B, C, and D, Medicare and Medicaid, CHIP. You know, those are Blue Cross and Blue Shield. Those are things that are really core to some of the things that we do. Inpatient and outpatient, acute and chronic, HIPAA, high tech, those things are really a key part of what we do in healthcare. And so you will need to know about that. You won't need to know about it this week. Okay.
Thank you.
Okay, sure. Are there other questions?
No.
For when we take the Peregrine exam, what
Yeah.
is the website to go to take that test?
So let's go back to here. We scroll up to here. So it should be, let's open that. Yes, so you should be able to, if you click on this link, do you see what I'm talking about?
Yes, sir.
Okay, and then this is your password, and be sure and select inbound exam. So when you click on that link, it will take you here, okay? And you'll need to include your registration password, and that is UNO-1001, and then proceed with registration, okay? Once you proceed with registration, it will ask, are you taking the inbound exam or the outbound exam? You are not taking the outbound exam. You are taking the inbound exam, okay? And again, it's I don't know if it's your before picture, whatever your before and after looks like, it's your before picture. And what it does, again, it gives us a snapshot of what our students are like as a group, and it helps us compare where students at the University of New Orleans are compared to other programs that teach healthcare management. Tulane would be one of them.
Thank you.
Sure, sure. I think our students are as smart as the students at Tulane. They just don't pay as much tuition. So anyway, okay. Are there other questions that you have? Again, folks, I am so sorry I spent 15 minutes on something that you didn't need to worry about. But anyway, if you have any questions this week or weeks to come, please let me know. And again, feel free to put something in the chat, and I'll be glad to work again to the conversation if that would help also. Okay. Okay. I don't have anything else if you don't have anything else. So with that, let me stop sharing and go back and say one more time, I'm glad I get to see all of you. And I will see you next week at Tuesday at 6 o'clock.
Yes, sir. Yes, sir.
Okay.
See you
Thank
too.
you.
Sure. Thank you.